Our goal is to help inform doctors, help inform patients, because very often patients are not comfortable talking about cannabinoids. Very often they're using them. And so we wanted, they're using them without telling their doctors. But it is an important discussion. I think doctors do have some information that they can glean from this study and other information that they can provide patients. First of all, I certainly do not recommend cannabinoids as a first-line treatment. I think a lot of people, who don't see a neurologist might be using them too early on in treatment. I would certainly recommend to any patients who were to watch this that they should be trying medications like triptans and Gepants prior to using cannabinoids because we know more about the long-term safety, long-term effects of those medications than we do about, for example, frequent use of cannabinoids can cause cannabis use disorder, and there's a possibility that they might put people at risk of medication overuse headache or headaches getting worse with frequent use. And then there's also concerns about cannabis hyperemesis syndrome, but we don't have data within the migraine population yet when people use these frequently, how effective they are. This study wasn't looking at frequent use, it was just looking at 4 treatments over the course of 1 year. So there certainly is more research is needed. One question that I get a lot is, well, vaporization, safety of vaporization. In this study, we used flower, and that's important. A lot of patients who might be going to dispensaries might be getting waxes or oils. Back in February 2020, there was a publication, New England Journal of Medicine, that showed some of the risks of the use of waxes and oils, that they can have contaminants such as vitamin E acetate that can cause pulmonary injury. And so in this study, we used, and what the NIDA drug supply program makes available is flower for vaporization, which is considered to be a safer option and is considered to avoid those risks associated with the waxes and oils that I certainly discourage my patients from using.